Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Today is December the 29th, part of our holiday week presentation for COVID conversations. We don't have a guest today, but that's because we have a tremendous amount of news about COVID in this last week. So we're really at an unusual time for COVID. In the world, we're at an all-time high in the number of cases, but the number of deaths is actually down. What we're seeing is a lot of disease in the US, in Canada, in Eastern and Western Europe. And we're also starting to see a bunch of disease in places that we haven't seen in the past. We're seeing a lot of disease in the southern part of Africa. We're starting to see disease again in Argentina and South America, and Australia, which has been relatively quiet during the early parts of this pandemic. Over the last few months, they've relaxed their restrictions, and now they're starting to see a lot of cases, probably due to Omicron. And Omicron is going to become a recurring theme, and we will certainly get to that later. In the US, we are at an all-time high number of cases. So higher than we had during the Delta surge, higher than we had during the Alpha surge last year, and much higher than we had early on. When you look at the heat map, what you see is that the Omicron disease looks like a map of international airports. So places that have lots of people coming from other places tend to have a lot of disease, and places in between not yet affected. So if you look at Boston, New York, Washington, D.C., Atlanta, Miami, Houston, and Denver, they have a tremendous amount of disease in those areas, and it's relatively quiet around those areas. But we know, like we've seen every time before, that it starts in the big cities and then moves its way out. On the West Coast, Seattle is hot. Portland is starting to heat up, but the rest of Oregon is pretty quiet. So that Oregon is starting to see an increase of disease Portland metro area, but we've not really seen that big increase in disease in the rest of the state. In Douglas County, we're at a relatively quiet time. We're at about 16 cases per 100,000 per day, which puts us lower than the Oregon average, lower than the national average, and puts us relatively quiet at this time. However, I don't think that's going to last. When we look at the hospital has a lowish number of patients, about 15 patients now, which is one of the lower rates of hospitalization that we've had since July. So it looks like our Delta surge is going away, but Omicron is here. So this week, we found our first case of Omicron. This is somebody who traveled internationally and arrived in Douglas County about 2 weeks ago. We heard that this person had traveled from another country, and so we did the testing. And just this week, we got back the variant analysis that showed that it indeed was Omicron. We do not think the person was contagious by the time they arrived in Douglas County, but obviously in traveling internationally, they may have exposed lots of people along the way. So while we don't know of any Omicron spread here yet in Douglas County, we think it's just probably a matter of time until it happens. And when we looked at the countries where Omicron is spread, it's really breathtaking in how fast it rises. So when we look at the change in case rates day to day, in the past, you'd see a change of 3 to 5 cases per 100,000 per day, which was a pretty steep rise. With this, we're seeing a change of 30 per 100,000 a day. So places like DC, the curve of new cases nearly vertical. And so they went from very few cases 2 weeks ago to the highest number of cases they've ever seen. New York had very few cases 3 weeks ago, and now we're at the highest they'd ever seen. So it really spreading and really spreading fast. And so the predictions that the country might see is million new cases a day, I think is not an unreasonable prediction. We're already at 250,000. As I said, most of the disease is in those places that have big international airports. But when it spreads to other areas, especially other suburban areas, I think we'll start to see a huge increase in the number of cases. So the bad news is we're likely to see the worst number of cases we've ever seen sometime in the next 3 weeks. Now, the good news, if there is any good news, is that Omicron does seem to be very different from the previous strains. So the Alpha, the Delta, the original strains all caused lots of respiratory disease, mostly among old people, and led to lots of hospitalizations, lots of ICU care, and lots of deaths. And so if we had this huge number of cases, and it was like the previous ones with lots of hospitalizations, lots of ICU care, and lots of deaths, this would be terrible. However, the good news is the Omicron seems to cause less severe respiratory disease in general. Now, there are clearly some very severe cases of Omicron, but in general, it appears to be less severe. So that the hospitalization rate in South Africa was about 1/10 of what it was with Delta. So for every 100 cases, there were about 17 admissions with Delta, but only about 2 admissions with Omicron. In the UK, which is a lot more like the US, their hospitalization rate is a quarter to a half of what it was before. Now, a quarter to a half is a lot less, but if the disease is that much more contagious, the lower hospitalization rate and the higher case rate will cancel themselves out, and we could still wind up with another very high number of hospitalizations. Again, as we've seen in the past, these hospitalizations are mostly among people who are not vaccinated and are much lower in people who are boosted. Sadly, in the past, a previous infection with COVID did seem to provide a lot of protection. We're not seeing that so much this time. So what we're worried about is that because we only have about 50% of our population that's fully vaccinated, those people who had previous disease or are not vaccinated may have more significant disease. Now, what we are seeing with the vaccines is the vaccines do seem to work. And so that especially the Moderna and the Pfizer vaccine, especially if you've gotten a full series and especially if you've gotten a booster, seems to be about 75% protective. If you've gotten just the first two, you have a 35% protection. Unfortunately, the J&J does not seem to provide very good protection. So the amount of protection you get from the J&J is quite a bit lower. So we are strongly recommending that people who are not vaccinated get started, for people who've gotten a Moderna or Pfizer to get boosted, and if you had a J&J to get a boost. And this boost with the J&J should be with either the Moderna or the Pfizer, and that should go ahead and get you some protection. Other questions about the monoclonal antibodies. So with the Alpha and the Delta, we had a monoclonal antibody called Regeneron. There was another one made by Merck, which seemed to be really quite, by Eli Lilly, seemed to be really quite effective in treating this. The problem is that with this new variant, the Regeneron and the Eli Lilly product don't seem to be very effective at all. And so while monoclonal antibodies were one of our mainstays during the Delta surge, that's going to be much less useful, I think, during the Omicron surge. The other new thing that's up is the development of antiviral drugs. So antiviral drugs are something we know a lot about. If people get herpes infection or chickenpox, you can use a drug called acyclovir. If you get flu, you can use a drug called Tamiflu. If you get hepatitis C, you can use antiviral drugs and lots of different names of those that are very effective in treating those infections. And up until now, we've not had a very effective antiviral drug. The good news is that there are now 2 antiviral drugs that are out there. One is called Molnupiravir, which is made by Merck. That is about 30% effective. And then there's one called Paxlovid, which is made by Pfizer, which is about 90% effective. And so these 2 drugs are out there. They've been worked on for many, many months, and they're finally have gotten approval. And we think they'll finally arrive next week. The problem, unfortunately, is we expect to have hundreds of cases of Omicron a day, and we expect to have 40 or 50 courses of these medications by the end of the month. So obviously, with several hundred cases a day and 40 or 50 courses, not everybody can get this at this time. And we're going to need to figure out a way to get this to people who are most likely to be hospitalized, because those are the people who will benefit the most. So this is a funny week. We've got some really worrisome news with very, very high case counts. We've got some very worrisome news with the rapid spread of Omicron, but at the same time, then we have some better than expected news with the lower severity, it appears, and the lower hospitalization rates with Omicron, and the development of these new antivirals. And in the middle of the news is the vaccines work, and they still continue to work, and we would really recommend that people get it. We had a vaccine event today. We gave 325 vaccines, mostly boosters, and we're going to be having clinics starting next week on January the 5th. Now, earlier we thought they'd start on the 5th, but they're not going to be able to get this together until the 5th. Well, starting on the 5th, and then weekday, they're going to be having a clinic in the Fowler Street lot across from the library, where they're going to be doing vaccines for all ages, first, second, or booster doses. So if you've not yet started, or if you need a booster, please contact your provider, or you can show up at the clinic starting Wednesday the 5th. Other things that have come up this week has been a little bit of a worrisome news on pediatric admissions. So as you know, during most of this pandemic, this disease really was very, very age dependent. Kids, when they got sick, were very unlikely to be hospitalized. In middle age, the risk of hospitalization went up. And by the time you got to be 70 or 80, the risk was very high. So among cases, the risk of being hospitalized, if you were a kid, was about 1 in 100 cases of COVID got hospitalized. When you got to be my age, about 1 in 9 cases got hospitalized. And when you got to be 80, about 1 in 4 cases got to be hospitalized. So again, there was a marked difference in the risk of hospitalizations. Unfortunately, with this disease, what we're seeing is an increase in pediatric hospitalizations far greater than in adult hospitalizations. So for example, today, there were the most pediatric COVID admissions ever today. And so that is a bit worrisome. So this pediatric sparing that we'd seen in the past may be left with the Omicron variant. We're going to watch this very, very carefully, because about the only good thing about Alpha and Delta was it didn't make kids very sick in general. If Omicron does make kids sick and leads to lots of pediatric hospitalizations, that will truly be a really negative thing. But in general, the good news is the vaccines do work, especially if you're boosted. So please go ahead and get boosted. We've seen some other questions this week about masking. And so, I was trying a story to figure this out. So, we have all kinds of rain, anywhere from a little bit of a drizzle to a really heavy downpour. And the amount of protection you need is related to the amount of rain there is. So if there's a little drizzle, you might just go out with a regular coat or a sweater. If it's raining pretty hard, you might go out with a raincoat. But if it was an absolute downpour, you would probably need a rain hat or a rain hood and a coat because of the heavy rain. Similarly, what we think happens with Omicron is that the viral load is just enormous in the bronchial tree. And so whereas a cloth mask may have been appropriate during the early phases, I think during this phase, we would recommend that people use as good quality mask as they could. I use an N95 a KN95 mask, which are widely available. KN95 masks are a little bit uncomfortable, but they really do work. For people who can't tolerate an N95 mask, we would recommend the best cloth mask you could use. And you can layer these together, and by layering them together, they'll get better. So we had one questioner that says, well, just that mask on my face I can't take, but I can take a cloth mask. So it's perfectly logical and perfectly reasonable to use a cloth mask underneath and then a surgical or a KN95 mask on top of that, and that will improve protection. However, this one is really very contagious. What we've seen is that even among vaccinated people, it can spread widely. Now, the one other good news we've seen about spread, though, has been about cruise ships. So cruise ships, public health people love cruise ships because they are a great way to see how disease spreads. And you remember very early on in the pandemic, there were several cruise ships that got a case of COVID, and then it spread to 20 or 30% of the passengers, led to a lot of hospitalizations and a lot of deaths. So the cruise ship industry really slowed down for a while. During Delta, they restarted, but really required lots of vaccination among everybody there. And what they found that there were many of these cruises that could continue with no cases. So that if you had 95% of the people immunized, there were basically no cases. If they had a case, there was no spread of those cases. So during it worked. However, now what we're seeing is that despite high levels of vaccination, this disease can still spread among ships. Again, because almost everybody is vaccinated, most of them are in the vaccinated people. But the good news is they don't spread very widely. So when we look at the ships, instead of having 10 or 20% of the people infected, like we did in early 2020, we're now having only 1 or 2% of the people get infected. And those people who get infected because they're vaccinated are not very sick. So as best I can tell, there have been no hospitalizations and no deaths related to those cases on the cruise ships. So again, I think what this tells us is this variant is really quite different. And this variant being different, it's probably really quite contagious. It's probably a bit less well controlled by the vaccines. The monoclonal antibodies don't work, and your risk of hospitalization if you get it is lower, but not so low as to be negligible. Still, still at 25 or 50% of the hospitalizations we had before, we're really going to be in trouble. So there have been all kinds of projections about how many hospitalizations we might expect in the next 6 weeks. Projections by OHSU range from anywhere from half as many we had this summer to twice as many as we had this summer, with the midpoint being about as many as we had this summer. And for those of us who lived that situation, that was really a really tough time for the hospital. And it'll be a little harder for the hospital now because there are staffing shortages, which were somewhat last summer, are worse now. And the background level of disease from flu and gastroenteritis and everything else is always higher in the wintertime. And so they're already busier with those things. So we're going to have a couple of bad weeks ahead. So the question is, what do we do? What's my best suggestion? So here's my best suggestion. My best suggestion is try and stay well. You certainly don't want to get sick at a time when the hospital is full. And what could you do to stay well? So the first and probably most important thing is to get your vaccine. And if you've not gotten a booster, get a booster. And we're having booster clinics starting on the 5th every day. You can go ahead and get your booster Some people, one question we had today, well, isn't it too late? If you don't get your booster until the 30th of January and this big surge is expected to hit in the end of January, isn't that too late? And so, yeah, don't wait till the 30th of January. Booster today or Monday or next week or next Wednesday at our through, and then you should have good protection by the time it arrives in full force here in Douglas County. The second is be careful about what you're doing. People like New Year's Eve, they have bowl games, they like all of these things, but this would probably be a winter to avoid those, because again, when you put a big crowd together in a bar or put a big crowd together at a big house party, there's certainly a chance that one or more people there will be sick and then can give it to others. And then if you do need to go to a crowded space, wear a good quality mask. And again, I try not to go out as much. I'm older, and so try not to go out. But if I do go to the grocery store, do stop at a restaurant to pick up some food, I do use a good quality mask when I'm there. So is this a time to panic? No, there does not need to be any panic here. Is there time to be concerned and prepared? Absolutely. So I would certainly have people try and be prepared. And what can you be prepared again? Get your shots, get your masks. You might, if you can, get some home testing, because I think if we have as many cases as they predict, we may get to a place where there's not obvious testing. You may not want to go out. So if you can get a test for yourself, please go ahead and get that. If you have an oximeter, certainly don't get rid of it. Oximeter is probably the best way to monitor if you do get sick, how you're doing. So you might want to go ahead and get an oximeter. And don't panic, but please recognize that we're likely to have 6 pretty tough weeks. Now, if there's any other good news, the good news is that this spread very rapidly in South Africa for about 25 days, but then peaked at about 25 days and then started to come down. The UK is no other country has peaked yet, so we don't know the top of their peak. The UK is into this about 20 days, and they're still seeing an increase in cases. So once we start to see an increase in cases due to Omicron, we're likely to see 20 or 30 days of spread before it rises, and then hopefully it'll go down as quickly as possible. The other good news could be that if Omicron is the last of the bad variants, or if whether vaccination plus infection with Omicron gives you protection against future variants, this really could spell the end of the pandemic. So it's hard to predict the future, but we can imagine a case where there's a lot of Omicron in January, February, but by March it starts to come down. And then by April and May, we have a very low case rate and a very low hospitalization rate. And that would be my fondest hope for the new year, that will nearly be past us. Now, the wild card in all of this is the development of variants. And variants develop with any disease, and they develop most when there's a lot of disease around. And what we're worried about is that as the disease spreads in Africa, and it's spreading widely in Africa now, there are a lot of people in Africa who have untreated HIV infection. And people with immunosuppression, either from chemotherapy, from solid organ transplants, or from HIV, can carry this virus for a while. And when they carry this virus for a while, it can spawn mutations. And there's really no way to control that without controlling disease. So there's some maybe good news, some maybe bad news. I hope I'm giving it to you about as straight as I can give it. And that's where we got. So if you have questions, please let us know at Facebook questions at publichealth.org, and we'll get to your questions. I hope this works out well for everybody here. Again, try to be safe, and if at all possible, please get vaccinated and or boosted. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. It's December 29th, 2021. We'll see you again next calendar year. Thank you. Okay, we're in about 2 minutes long, but otherwise I think it's good to go. I can't hear you. Are you on mute? There we go.
There we are.
All right, I think that's good.
We were having a little glitching.
Maybe it's on your side. There's no glitching.
So I need.
Yeah, there was no glitchiness on this side.
I'll have to
Okay.
see
Send me an
how the
email.
record. Hopefully,
Okay.
I'll send you.
All right. Send it
All
to
right.
me.
Thank you,
We'll take a look. All
Dr. Bob.
Bye-bye.